everyone. This is Dr. Richelle Demers from Harrisburg Joint and Muscle, and tonight we are going to be talking about carpal tunnel syndrome. Thanks for joining me tonight. I know it's beautiful weather out, so sorry we're keeping you in, but carpal tunnel is one of those diagnoses that and treatments that we have good success on, so we want to talk about that tonight. All right, so we're going to go over a couple things with it. First, I want to go over what exactly carpal tunnel syndrome is. Then we're going to go into the different causes that it can come from, and then our diagnosis and treatment of carpal tunnel, and then why proper diagnosis by a chiropractor or medical doctor is very important. Okay, so let's start off with what carpal tunnel syndrome is. So its broad definition is compression of the median nerve underneath the carpal tunnel or within the carpal tunnel. So let's break that down. So your carpal tunnel comes right around here. Okay, so let's go over some brief anatomy. So what I'm touching here is, let's pretend it's the roof. So it's the top aspect of that carpal tunnel area. So the roof here is covered by a ligament called your transverse ligament. So this ligament runs along the top, and then what runs along the bottom, as you can imagine, right along here is your carpal bones. So you have a floor of carpal bones and then a roof of this transverse ligament. Within that space, you can picture it's sort of an oval. So if you're looking sort of down on the hand, you're looking at an oval shape. So in this oval, some of the structures that run through it are your finger flexors. So finger flexors are anything that helps you make a fist, so a grasping position. So all of them come through the carpal tunnel and attach to the fingers here and really just help you to close down that hand. The other structure that runs through the carpal tunnel, like I said before, is the median nerve. So that median nerve is very important because it has both sensory and motor innervation in the hand. More specifically, it has sensory and motor distribution to the thumb, the pointer finger, the middle finger, and then actually half of that ring finger. So most people feel it here, but some can get a little bit in that ring finger. And we're mostly focusing wrist up. So that's what carpal tunnel will be. So wrist up in this area here. So when that area is compressed, as I said, it's an oval shape. When it's compressed, it's going to close down on that space. When that space is closed down, a lot of people will experience numbness, tingling, even muscle weakness into this area of the hand. So that's what we're looking for carpal tunnel syndrome. Tingling, numbness, sometimes it can even feel like a burning or feels like swollen fingers in that area. Sometimes you have a hard time grabbing your morning coffee, anything with a gripping motion. So that's what we're truly looking for. Another common sign or symptom of carpal tunnel is the pain waking you up at night. So in the middle of the night, some people sleep with their wrist tucked under. So as you can imagine, that closes down on that space right there and can impinge that median nerve. So with that, we have a lot of patients that say, it woke me up in the middle of the night. I had to basically flick my wrist out, shake my wrist out to try and get that feeling back in the area. So that's always also very common with carpal tunnel syndrome. So now that we sort of know what it is, let's go into common causes of it. So a few of the most common causes are repetitive hand movements. So like I said, that area, all that area does is finger flexion. So a lot of finger flexion there. So you can imagine any type of chronic movement of those fingers, so texting. Also people on computers or people who are typing all day, people answering phones as well. You're constantly holding that phone up to your head. So it's those repetitive movements that you're more predisposed to get carpal tunnel syndrome. Another one is repetitive grasping motions. So if you're going to paint your house and you're grabbing that paint wand and the brush and you're painting the wall all day, or you're going out and you're gardening because it's getting nice and beautiful outside and you're picking up some gardening tools and you're feeling that pain. It's any of that chronic or repetitive grasping motion. Some other things that can cause it, maybe less common but can still be considered a cause, are inflammatory conditions such as rheumatoid arthritis, or metabolic changes in your thyroid gland. It can cause a little bit more swelling in your body and cause carpal tunnel. Another basic one would be sprain or strain of your wrist. So you can imagine any type of inflammation in that area will close down on that median nerve and cause that pain in the hand. Women who are pregnant are also much more predisposed to this because when you're pregnant, you retain a lot more fluid. So when you're retaining fluid, it'll close down on that space and cause some carpal tunnel problems. So now that we've gone over that, let's go over how we truly diagnose carpal tunnel and then what we do to treat it. So carpal tunnel diagnoses are very important because they do have a lot of conditions that are very similar to it. So what we do here in office is first, when a patient walks in with carpal tunnel syndrome, we look at the hands. That seems really basic and pretty boring, but what we're looking for is this area. It's called your thenar, so it's your thumb muscles. One condition of chronic or long-standing carpal tunnel syndrome is what's called thenar wasting. So we're looking to make sure that this muscle is not atrophied. So it's not smaller than the better hand, than the good hand. So really we just have to make sure we look at that area because that's very important. So after we take a look at that region, thankfully we don't see any thenar wasting, hopefully. Then we go on to our orthopedic and neurological tests. So orthopedic tests, we're checking for the integrity of your wrist. We're moving that wrist around, we're putting it in different positions. We're trying to elicit that pain, numbness, tingling, whatever you're experiencing with carpal tunnel through those orthopedic tests. Next, we go into our neurologic tests. So like I said, the median nerve does both sensory and motor. So we're checking the sensory of the area. We're making sure every finger feels the same on both sides. Presuming that you have one good hand and one bad hand, we want to make sure that we can feel the difference, or if there is a difference. And then we will also check your muscle strength. So we want to make sure you can still grasp down on objects and you have that strength in your hands. So after that, when we truly have a diagnosis of carpal tunnel and we have diagnosed that, we're sure of it, we are going to move on to treatment. So we do have several treatments. We always tailor our treatments to your specific condition and whether it is progressive or it is acute carpal tunnel, depending on how long you've had it for, everything like that. So we've had really good success with what is called Graston. So many of my patients know this tool and love to hate it or hate to love it. And it is a tool that runs along the area and helps get rid of adhesions in the muscles. So what our adhesions are little bits of scar tissue that hold ligaments, hold muscles and areas really tight and don't allow them to move properly. So we want to use this Graston tool to loosen up those areas and help align and get that area moving. So this is the basic tool. What I usually use for carpal tunnel is something that looks like this. So what we do on the carpal tunnel, as you can imagine, the transverse ligament is right across here, which is the roof to the carpal tunnel. So I'm going to run along this transverse ligament in all different directions. I want to get that ligament moving properly. I want to increase the space in that carpal tunnel and really get some movement in there so that we're not compressing the median nerve any longer. So that's a really beneficial treatment for it. With this too, it looks really aggressive. It's not. We tailor it to your pain. We make sure that you can handle it. It's not going to be more than you can. Okay, so that's our first mode of treatment. The second, we usually will then go on to a muscle work of that area as well. So our office, we like to do a lot of muscle work and make sure everything is moving properly. So we'll take a look at the flexors. We'll make sure that they're stretched out. We can stretch out the hand, and then sometimes we'll even stretch out the forearm. Even though true carpal tunnel doesn't go up into the forearm, we will stretch those out because a lot of the people with those repetitive activity injuries or repetitive activities that are causing carpal tunnel will have tight forearms. So we will stretch out those forearms. So that's what we'll get to after the muscle work and the stretching. We'll then get into adjusting the wrist. So the bottom floor of the carpal tunnel are your carpal bones. So all those carpal bones have little joint spaces in between them. So we will adjust the wrist, get those bones moving, make sure again that there's more space like we just did with that transverse ligament on the roof of the carpal tunnel. So after that, we will take a look at it. Sometimes we'll ice it down, sometimes we'll heat it, just depends on what you need, okay? Another thing we like to address during our treatments, especially with carpal tunnel, because of the inflammatory component of it, is making sure that your nutrition is on par for that condition. So we'll take a look, if you do have thyroid issues, making sure you're on the right vitamins for it. If you have rheumatoid arthritis, making sure that you're on the right vitamins or supplements while you're taking your other medication for that. And then if you're pregnant, making sure you're on the right prenatals, prenatals that aren't holding more water in your system than you need to. So we'll be checking on nutrition and going through that as well when you come in for your carpal tunnel evaluation. So those are all really important. Sometimes on advanced cases of carpal tunnel, we'll actually suggest a night splint. So what that does is, again, a lot of people like sleeping with their wrists bundled up, and that just closes down on the space. So while we're treating you, we want it to heal as straight and open and wide as possible so that we're not getting that compression. So what a splint will do is just keep your wrist neutral at night and make sure that when we're working on it for several appointments at a time, that you're not just ruining it at night with that sleeping. So that splint keeps everything open. Yeah, so those are our treatments of carpal tunnel. There are other things we do, but those are the basic ones that we've had the most success with. Let's go over different diagnoses and why it's so important to get a proper diagnosis from your doctor. There are many different syndromes, I won't even say syndromes, just other different diagnoses that can mimic carpal tunnel syndrome. So there's three that I'm going to talk about. The first one is called thoracic outlet syndrome. So thoracic outlet syndrome is when you have compression of vasculature and nervous tissue at three different places. So it can be under your collarbone, by your rib, or by tight muscles in your neck called your scalenes. So with this, you will get sometimes pain, sometimes numbness, and sometimes even muscle weakness down the arm. So as you can imagine, a lot of people are feeling that, and they can feel it all the way down into the fingers. So we need to distinguish between, okay, is this thoracic outlet syndrome or is this carpal tunnel syndrome? So we need to make sure we're doing that evaluation. Another condition that can be very similar to carpal tunnel is different compressions of the median nerve. So the median nerve is commonly compressed in the carpal tunnel, but can also be compressed in the forearm. So if we're getting compression at the elbow, at the forearm, wherever it is of that median nerve, it works its way down and it can mimic carpal tunnel. But we need to know that carpal tunnel is wrist into the hands and not forearm. So we need to make sure we're treating the original source of the impingement and that compression rather than just the symptoms. So we really need to get to the root cause. So we'll go over that and make sure that it's not different median nerve compressions. Last but not least is nerve pinch. So a nerve being pinched in your neck can also create these symptoms. For example, C6 nerve compression, which is more at the base of your spine here. With that nerve compression, you can actually get muscle weakness, tingling, and pain, which are all the same symptoms as carpal tunnel, in the outside aspect of your forearm, and then into the thumb and the pointer finger. So very similar to carpal tunnel. So a proper diagnosis is truly key for that, because you don't want someone treating here when the real issue is in your neck. So make sure you get to the doctor, make sure you get to your chiropractor, make sure that that is an accurate and true diagnosis of carpal tunnel. So we've been over a lot of information tonight. Feel free to reach out if you have any questions. You can leave a comment on this post or message us directly. You can give us a call at 717-999-4347 or check out our website. You can book online there as well. I hope this was helpful. Let me know if it was. I'm more than happy to do another video if you need a more in-depth study of the carpal tunnel, but it has been nice talking to you guys tonight, and I hope you have a wonderful spring day. Bye-bye.